At any given time, around 50,000 adults are imprisoned in Australian jails. For most, it's a world that exists in the shadows. Now, a new study exposes a grim reality of drug use inside, with former prisoners telling researchers how people inject substances while incarcerated.
One time I used that fit that's made out of a bread bag, a pen and a sunscreen tube. They shot me up in the side of the foot and ended up getting infected, and I got acute hepatitis.
You'd see girls with welts on their arms from missing, and they were getting elephant arms because they had swelled up so much. Most girls wouldn't seek medical treatment because they'd be caught for using.
Co-author Tim Piankovsky says illicit drugs and needles are smuggled in.
That piece of equipment gets, sharpened on the floor, on the toilet. It gets cut down.
Scant equipment is shared by prisoners, amplifying the health risks.
I've counted 86 people use one needle in one day, and we had that needle for 6 months, 12 months. I've had a needle for 2 years once.
Out in the community, needle and syringe programs have been running since the 1980s, reducing needle sharing and curbing the spread of viruses like HIV and Hepatitis C. Countries including Canada, Spain and Switzerland have prison needle programs, but no Australian jurisdiction has taken up the measure. Doctors want that to change.
There is a community risk involved here too, that obviously when people are discharged from the prison system and they are carrying these bloodborne viruses, they pose a risk to others in the community at that point.
Without more action in prisons, the national goal of eliminating hepatitis C by 2030 is in doubt.
We believe that needle and syringe programs and access to sterile injecting equipment will be a critical arm in being able to reach those elimination targets because of the reinfection risk.
There's an economic argument too. Modelling has found every dollar spent on prison needle services would save health systems $2.60, which equates to a saving of at least $20 million nationally over 5 years. When asked, some authorities said needle programs could risk the safety of prison staff.
From our point of view, we've seen no evidence put to us that by introducing needles you're going to make it safer on the ground for officers and indeed for other inmates.
No state or territory is planning an exchange system in its jails. A damaging and expensive cycle seemingly set to continue.